Do you have back pain? Are you missing out on some of the simple things in life, like going out in nature and hiking, picking up your grandkids? Continue watching this video, and I'll explain to you how I can help you overcome back pain. In 2005, I had to have an emergency surgery done on my L4, L5 area. Right here, I had a bulge in the disc that fragmented off into two small pieces about the size of a pea, and they lodged on my nerve here to where I could not stand, I could not walk, I had to crawl around just to get around the house. So after the surgery, I had to figure out how that happened, why that happened, and I wanted to continue on with my lifestyle of being very, very active. So what I had to do is go get the education. I had to figure it out, and then I had to make sure that I will not have that happen again. And to this day, I always think back first. Here's an image of my spine back in 2005. So you saw my image. That image showed a very flat back, right? But also within that flat back, I had what we call a side bend in that lumbar area that created a high risk with a bulging disc. So many of us have proper lordosis, small curvature in the low back. It helps with the springing effect in the body to absorb shock. Many of us, with that lordosis comes a flexion with the hips, a rotation forward. So some people have an extreme lordosis, which means extreme rotation anterior with the hips. Many people, like me, have a pogo stick type of back, a flat back, a flexion lumbar spine with extension with the hips. Also, like me, coming with pairs, some people have a side bend, so it can be the other way as well. Sometimes with that side bend, we have a hip that will flare out to help compensate with that. Another postural issue is torsion, where the transverse processes come forward and create a twist. So the hips have to adjust with that as well. One will go anterior, one will go posterior. So that can happen that way. So in other words, all treatment has to be decided on how the lumbar spine is relating with the hips. Same with an exercise program. You cannot have someone with extreme lordosis do the same exercises as someone with a pogo stick back. You're going to get two different results. If you do the same thing, one of those persons is going to get hurt. Same thing with someone who has a torsion in a spine going this way. That person is going to squat differently than a person who torsions the opposite direction. Does that make sense? So for all you therapists out there, all you personal trainers out there, all you coaches out there, get to know your athletes first. Get to know the person that you're working with, your clients that you're working with first. By doing the muscle testing properly to identify these areas, and then you know where to treat, how to train, and how to bring up better athletic performance without a high risk of injury. Please contact me today if I can help you out. I teach clinics with personal trainers and coaches of track and field athletes and other endurance athletes, and I also have a therapy practice